Yes.
I had a little comment to make. You know, what I think is Allah sent us here for a reason to this continent. And as we are like, we have to carry the message of Islam. So, you know, we need to be a little bit different than the usual physicians here. Most of us are physicians who are attending this conference. And also in any other field that they need to make, all of us need to make da'wah. Like,
to make what?
To da'wah, for
yes,
da'wah.
Yes.
You know, like if we are a little bit different than other physicians, instead of giving 5 minutes, if we can give 15 minutes, especially to a patient who is having, you know, like marital problems, like being gynecologists or, you know, family practitioners, whatever problems that those patients have. And then when you keep talking to them, then they usually ask, what does your religion say? So you can, you know, open to them about Islam. You can have little pamphlets in the office. You can display anything like the, you know, the English translation of the Quran at the office, so that they can come to you. And these are indirect ways of dawah. You don't have to tell them to be a Muslim, but by the way you present yourself differently compared to the usual American physicians, you know, they will come towards Islam. They will keep asking you questions. Like if you are wearing a hijab to the office, they will ask you why. So you can have little pamphlets to give it to them. And like I have seen patients who tell me that they have never heard any doctor, even if they are Muslims, talk about God. So they are very happy to know that there are some physicians who wants to talk about God. And like if you are a surgeon or you know, doing surgery and all that, you can. Most of the patients, they take my hand in their hands and pray right before going to surgery, you know, and things like that. That will be very important for those patients to know that we are different compared to the regular physician, and they keep trusting you more that way.
You should be blessed by Allah subhanahu wa ta'ala to have a wife like that. I don't know. I don't know. I'm saying it publicly, so every husband, every wife, if the other partner of your spouse is in that category, that's the climax of what we should do in America. And usually I tell the physicians, you are more blessed than anyone else in making da'wah, because the patient coming like crying, please tell me what I'm supposed to do. You can make the best da'wah. I have one brother from Pakistan in our neighborhood. He used to put Quran and Bible and Torah in the waiting room. Every time he put the Quran, he went out. I said, very good. People are fed up of Bible and Torah. They want to see this book, Quran. And he put literature introducing Islam. That's the right way. There are too many nonsense magazine, filthy, dirty, which has nothing to do with Islam. I mean, with your profession. I mean, like US magazine and every other LA Times newspaper magazine, sports magazine, whatnot. Oh, Hollywood magazine. Why? Why don't you put some literature about Islam? Hey, me put Islam? No. I don't want them to know that I'm Muslim. Khalas, get off. You don't want? Your name is a Muslim. Yeah? Even if you are not with hijab, your name is a Muslim. Khalas. But even with hijab, that's the best thing. I'm glad that you said what you said, but I hope and I pray that we take it seriously what she said. It's not only the hijab, it's the treatment. You say God, tell them I'm not the Shafi. The healer is God. I am a means for healing. I'll pray for you with the dawa. And if you take the dawa, that from Allah and dawa from Allah, but I'm a means for shifa. The one, I'll make dua for you, prayer for you, so God will give you healing. Really? You doctor, you make prayer for me? That's the minister, or the rabbi, or the imam. No, me too. I'll also pray to God to heal you. That is da'wah. Believe me, what you said is 100% true. And I want every brother, every sister in your profession, really, you medical doctors, you are more to make da'wah than any one of us. Because you have how many patients a day? Approximately, all of you. Approximately how many patients? 20 and above. 20 people coming to you with mercy, crying. And while you are testing whatnot, you pass information about God without saying Islam, Islam, Islam. God, God, God. God is merciful. God is the healer. God is sure. They feel happy. Because most of the doctors you go to, they have no time to socialize or to talk. Yalla, finish. Give me time. I have no time. So I'm glad that you said. I wish we take her statement seriously, all of us, whether you are doctor or no doctor. When somebody comes to you, be patient. Don't kick them out. Give them some time. They'll come again. They love you. Even what we do. Why they come again, I don't know. Because maybe we give them time. But I'm not telling you to do what we do. 8 hours for a pair of one family. Again and again and again. They are happy. So, inshallah, the more you make people happy, the more Allah will make you happy. سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله والسلام عليكم ورحمة الله وبركاته.